Hey everybody, welcome to Monday Night Lives with me, Dr. Jarod, holistic chiropractor, holistic health, passionate person. Welcome, and I'm here every Monday night, 7 p.m., unless I tell you I'm not. I'll tell you in advance to answer your questions. So if you want a holistic doctor to chime in on your life, give general educational advice towards you for free, this is your time to join. So anyways, welcome, my friends. Also, to shout out, I am currently running a Black Friday bonus deal on my liver cleanse that has rave reviews. Everyone who's done it, I've had hundreds of people do this cleanse. Everyone feels better. Everyone loses inflammation. Everyone gets more energy, better sleep, etc., etc. So you could be the 1% that doesn't, but anyways, it's very, very great and awesome reset. The next big group liver cleanse I am doing in January. We start January 12th. So hop on it. Join us. It would be awesome to have you. I will be dropping and letting you know about a little bonus discount code at the end of this live tonight. So come back if you would like that. All right. Questions. First question is a sweet friend of mine. Glad to know she's sweet. She's 21. She has fibromyalgia and idiopathic rheumatoid arthritis. She's in extreme pain. What do you recommend? Well, first of all, I would recommend all autoimmune disease begins in the gut. I always say that, and it's true, because when the gut is inflamed and leaky, you develop problems and autoimmune conditions. So I would start her on something like Ion Gut. I think it's called Restore now, actually. Nope, it's still called Ion Gut. It used to be called Restore. That you could take like 3 teaspoons a day. That's going to help seal up the leaky gut. It's one of my favorite things. It's really easy to take too because it's liquid and it doesn't taste bad. So I would start there. You also want to do an anti-inflammatory like turmeric forte. I would do 2 tablets twice a day. You can get that at the link in my bio. And then I would also do something that supports the soft tissue, right? Because what is fibromyalgia? Fibro means fiber, myo means muscle, and algia means pain. So really it's just pain in muscles and fibers, right? That's what that big fancy word means. And so is it really telling you what's going on? No, it's just a fancy way to describe your symptoms. And a lot of times medical diagnostics is just a fancy diagnostic system. So, for example, one of my very close friends when I was early on in chiropractic school, she was experiencing extreme pain in the upper right abdominal region, right here, kind of near the gallbladder. She had a family history of gallbladder problems, and in fact, multiple relatives of her had gotten their gallbladder removed. So I went to her to the hospital because I think it was over Christmas break, thinking surely they'd run some tests and find out that it's the gallbladder. Well, after many hours and running tests and whatever, the doctor came in and was like, "You can be at peace. I have your diagnosis. It's epigastric pain." And I looked at the doctor because epigastric just means above the stomach pain. And I was in chiropractic school my first year, and I was like, "Are you kidding me? We're here for hours and that's like your grand conclusion?" And they're like, "No, it's not the gallbladder. There's no way it's the gallbladder. The test didn't come back to what they wanted to see." I'm like, okay, whatever. So they gave her like some kind of numbing anti-pain medicine to drink to cure her diagnosis of epigastric pain. And I was like, I could have told you that. Why are you billing me for this? Why are you billing us for this? Anyways, long story short, she ended up indeed getting her gallbladder removed several months later because it was her gallbladder. But anyways, all that to say, diagnostics is kind of annoying. So when someone has fibromyalgia, I'm like, okay, they have pain in their muscles and ligaments. That doesn't tell us why. I think why she has it is because she has a leaky gut. She's probably developing, she has idiopathic rheumatoid arthritis. Rheumatoid arthritis means autoimmune reaction that hurts your joints, right? So she has an autoimmune reaction that's hurting joints. What are joints made of? Collagen, a little bit of, amino acids, things like that. What are muscles and fibers made of? The same thing, right? So she's probably developing an autoimmunity to her own soft tissues. So you need to calm the autoimmune storm. So I would do, like I said, Ion Gut, turmeric forte, I would do cardiotrophin PMG. The reason on an empty stomach, the reason why it's called cardio, but it's really for muscle, for the heart muscle. And it's muscle. And what it will do is it basically soaks up all the autoimmunity against the tissue and distracts it and makes it go after the product that you're taking instead of the tissue itself. So that's where I would start. Happy to help her if she needs more help individually. All right. Someone else says constant low energy and headaches. What do I recommend? 38-year-old female, fairly clean diet. 100% my liver cleanse. Because headaches a lot of times can be from liver and too much toxicity in the body. When you cleanse the body, your brain is no longer sitting in muddy water and you feel a lot better. When you have less inflammation in the body because you did a cleanse, you feel a lot better. Right? Doing a liver cleanse is all about supporting your cellular function and making everything squeaky clean, and it works better, right? The liver is the filter of the body, and many of you have never ever changed your filter or cleaned your filter. So it's very, very important. And then also, if you're living in sludge, you're going to have low energy. So, and I know it sounds like I'm just pushing my cleanse, which I am, but it's an amazing, it literally, if she came into my office and was my patient and this was her complaint, that's what I would recommend because it's most likely going to solve those problems in 3 weeks, which is awesome. So that's what I would do. And then of course, chiropractic care, if the headaches are truly a structural issue coming from the neck. And then, whenever you get adjusted, it upregulates your nervous system and upregulates the computer system of the body. When the computer system of the body works better, you work better and you have more energy. Every time you get adjusted, it stimulates neurological organization, right? The Bible talks about basically rewiring your mind, like taking captive your thoughts, right? And retraining your brain, right? And a chiropractic adjustment helps do that as well. There was actually one of my professors when I was in school, he did a lot of research and he was passionate about chiropractic paired with addictive recovery from addictive behaviors. And those who were under chiropractic care were able to recover from addictive behaviors at a much more successful rate than those who were not. Because every time you get adjusted, it helps your brain make a positive and lasting change for the better, right? So whenever you have low energy, headaches, that could also be neurological dysfunction. So chiropractic care, liver cleanse. That's what I would recommend for that. How to gently detox candida. Next question, candida. How to gently detox candida without triggering a Herx reaction. So Herx reaction means basically you detox too fast and your body gets all inflamed and swollen. You can't poop. You don't have good energy. You might even feel like you have flu-like symptoms like a fever, right? That means you went too fast. A lot of my patients don't really have a Herxheimer reaction because I'm doing muscle testing. But to gently detox candida, I would try Zymex from Standard Process. It helps acidify the bowel. And when the bowel is acidified, candida does not like it and it can't do it as well. But it's not like doing strong herbs like oil of oregano or berberine or whatever. So it would be a gentle place to start. One of my favorite products for a really bad candida infection is called Lufanuron. That is basically candida are like little crustaceans. They have an exoskeleton, and so they have a hard little shell. And so they're swimming around your bloodstream, and you need something to dissolve that shell so that the white blood cell can then come in and nuke them, right? So the Lufanuron, you have to take it with fat. It helps dissolve the shell so that then your immune system can take care of the candida problem. What are symptoms of a candida problem? Itchiness, white coating on the tongue, itchy skin, perhaps chronic vaginal microbiome problems, chronic UTIs, irregular stool and bowel movements, inflammation, joint pain, things like that. Foggy brain, that can all be candida. All right. What is best to use for GERD? GERD is gastroesophageal reflux disease when you have heartburn, right? So look alive, people. I hope you're not bored. Look alive. But gastroesophageal reflux disease, so many people have GERD and so many people are put on PPIs for like the rest of their life, proton pump inhibitors or antacids, right? Here's the thing about GERD. I've talked about this on my page before, so if you followed me a while, hopefully you know this. The phases of digestion. Let's talk about that. Okay. You swallow your food, it goes to your stomach. Your stomach is supposed to be this amazing, strong acid, instantly dissolving everything that hits it chamber, right? When it is acidic enough, that is the cue for the stomach to be like, tick, 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 next phase, and then it drops into the small intestine. Because it's acidic, that acid triggers the small intestine to open some valves, and then we throw in more enzymes from the pancreas, the gallbladder, and the liver, right? If you don't get acidic enough, there's never that knock, knock drop to the small intestine. So GERD is actually from the food just festering and sitting up here because it's actually not acidic enough. Yes, it feels acidic, but it's not potent enough to move on to the next phase. So then it just begins to rot. And when it rots, it begins to just splash up into your throat, giving you that painful chest, heartburn sensation, and maybe even an acidic taste in your mouth where it begins to degrade your teeth if it's really bad. So that's GERD, right? So many people then they're like, oh, well, my stomach's too acidic because I feel it. So therefore, let's take an antacid. So they take an antacid, and so they temporarily feel better, but did they trigger that knock, knock, pop to the small intestine? No, they made it worse. Therefore, finally, when it does move to the small intestine, because you're just getting full, again, what triggers that extra enzyme and absorption in the small intestine? The low acidity triggers those enzymes being added to absorb the nutrients. So if it's not acidic enough, it never triggers those extra enzymes. You don't absorb nearly as much nutrition as you should, and then you basically, you pass on the rest of the food. And so because you have GERD and because your stomach acid isn't strong enough, you not only don't move things along properly, but you don't absorb anything either, and you have pain in your chest and throat. Okay, so when people take those acid reducers, they're not only not solving the problem, they're also making sure they don't absorb their nutrition. And when you don't absorb nutrition, your hormones suffer, your bones get brittle, right? Your brain suffers, right? You don't have what you need. You become frail. And so I think there are a lot of people out there who have been on PPIs or proton pump inhibitors, antacids, for decades, even though they are classified by the FDA as for short-term use only, but they've been on it for decades because they're very hard to get off of them when you're on them. And I think they're deteriorating because your body's starving. You don't look like you're starving, but it's starving of key nutrients. So anyways, treating it, you actually need to increase stomach acid. One of my favorite, or you need to support digestive absorption, right? If you have an ulcer, if you take Zypan, it will hurt, okay? Because Zypan helps gently increase stomach acid. Zypan from Standard Process, you can find it at the link in my bio. That will help GERD a lot if you don't have an ulcer. If you have an ulcer, because a lot of times people have ulcers, because here's the thing, why do ulcers develop? Ulcers happen not from too much stomach acid, because our stomachs are made to be very, very acidic. Ulcers happen because there's not enough stomach acid, and then a bacteria gets in, creates an irritation in the lining of the wall of the stomach, and then that irritation doesn't have that mucus protection, and then the acid can burn the stomach wall because the mucus is gone because the bacteria got in there and messed things up. The bacteria were able to get in there because you didn't have strong enough stomach acid. And so now they can live there because they're fine. There's a type of stomach infection called H. pylori. They actually are very strategic. They go into the stomach and they attack the cells that make stomach acid. So they find a little weakness, they get in, and they keep perpetuating that weakness. And when you have low stomach acid, then you're more prone to parasitic infections, bacterial problems, and then, of course, GERD. So we need to bring that stomach acid back up. Zypan, if you don't have an ulcer. If you have an ulcer that's bacterial in nature, we have to go slow. I would use echinacea or golden seal to kill off that infection. Then I would also nourish the lining of the stomach with something called chlorophyll complex. Also, to help you absorb your food, if you have an ulcer, you would use multizyme because it's enzymes that help you absorb your food that should be there, but it doesn't have that extra acidity added to it like Zypan does. So if you don't have an ulcer, use Zypan because you're going to fix your stomach acid problem. If you do have an ulcer, use multizyme. Got it? So that's pretty much what I would say for GERD. See how that goes. If it doesn't get better with that, you can use the links in my bio. But if it doesn't get better with that, then let me know. And we can perhaps work together because you might be a bit more tricky. So, That's what I would try. Hello, everybody. Thank you for joining. Appreciate it. Next question, how to tackle high glucose or pre-diabetes. Easy, 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 easy. You can fix it very easy with some discipline, okay? Diabetes is an overconsumption disease. So if you overconsumed your way there, you can usually consume your way out, okay? Favorite things for high glucose or pre-diabetes. You need to think about chromium. One of my favorite products for just blood sugar management in general is called Diaplex. It's named Dia for diabetes, Diaplex. And it basically every part of the blood sugar handling system, Diaplex helps deal with. It has chromium in it, which is a mineral that helps reduce blood sugar spikes, helps support blood sugar control. It has pancreas control in it. It even has a little bit of liver support, right? Because your liver is in charge of blood regulation, blood sugar regulation as well. And then it has some enzymes to help you digest your food. So it's a really great broad spectrum product that will support all of that. In general, if you're pre-diabetic or your hemoglobin A1C is getting above 5.3, so you won't be determined and called pre-diabetic till 5.7, but I actually care if you're 5.3 or above, right? So intermittent fasting is a great thing to do if you are not trying to have a baby, or if your hormones are okay. Intermittent fasting is a great thing to do to help correct the hemoglobin A1C marker. So also stay away from refined carbohydrates, sugars, grains, breads, alcohols. All of those will spike your blood sugar. And if you are dealing with prediabetes, you don't need that. So that's what I would do there. Berberine is a great way to reduce diabetes, to help support your body, reduce that blood sugar. What else? That's pretty much it. That's what I make my people do. Yeah, if you do that, that's a great start. Okay. Do I have a cleanse for kids? Yes, I have a parasite cleanse for kids. There's also some things on Amazon you can try. There's Bio Happy Ray, I think is what it's called. That works pretty well. Sometimes it doesn't eradicate parasitic infections though, so I have to give kiddos my protocol. You can call my office for that, or you can, I guess, get it online. But at the links in my bio, but there's, I use Paracord, Contraflex Chewable, and Black Walnut Supreme, 3 products. Paracord is like homeopathic, so it tells the brain, it gives the brain a signal to do something. Oh, there's a parasite, I should act upon it, right? Black Walnut is pretty tasty. You can put it in juice, whatever. It helps kill parasites directly. And then Contraflex Chewable is a tasty little chewable that I'll give to really any kiddos with any type of immune problem. It keeps them from not getting sick, helps them when they are sick. But Contraflex Chewables helps support their own immune system as they deal with the parasitic infection. So I would do that. And then I have gentle other cleanses. Nothing really bundled for kiddos besides that. That's a really good one. But in general, for kiddos, I love Acerola Supreme. These are all from Supreme Nutrition products at the link in my bio. Acerola Supreme, Scutellaria, Elderberry Supreme, and Black Walnut Supreme. So Acerola is vitamin C, which is great. Elderberry is for antiviral. Scutellaria is like anti-pain, antibacterial. And then Black Walnut is anti-parasitic, antimicrobe, if that makes sense. So those are super helpful. All right. Someone said Hazel's coming down with something viral. Reschedule. No. Get adjusted if you're starting to get sick. It will help stimulate your immune response. I literally had people. I had a kiddo come in. She was pretty sick. I think it was about 2 weeks ago. She came in. She got adjusted. I modulated her supplement protocol. The next day, I saw her dad, and her dad was like, "Oh my gosh, she's night and day difference from yesterday." So kids bounce back quick, and adjustment is really, really helpful for when they get sick. So I always encourage my patients, if you can walk, if you can function, come get adjusted. I'll be fine. My immune system is strong, and yeah, don't worry about me. So that's my opinion. Someone asked best postpartum supplements. Great question. There's so many that you should be on. You want to do, I usually recommend Min Checks, because Min Checks supports kind of that like low, sad mood, which can often happen postpartum. So that's really great. I recommend Ovex because that supports hormones, and you have a really big crash in hormones after delivering a baby. So that's important. I also like Easy Mag for that gentle brain food, that sleep support. I also like, if you had any tearing in labor, I recommend Gotu-Kola complex from MediHerb 2 twice a day, and Cataplex ACP that helps basically heal and prevent scarring. Those who take that versus those who don't, and I'm not just talking about tearing, but like whether it's like post-surgical, people can take that after a surgery. Those who take that and those who don't, there's a very clear difference in terms of reduction of scarring and regaining normal function of the soft tissues. So that's what I would recommend. Cataplex B Core is an amazing product for a whole food B vitamin, deep restorative nutrition postpartum. So yeah, I would start there. And then if you have any other questions, happy to help you. All right, guys, that's all my questions. I don't think I had any in the chat today. You're always welcome to ask. And I'll do my best to answer. Now for my Black Friday code, just want to let you know that it is all caps, Black Friday 50 for $50 discount. It's only open until tomorrow at midnight. So if you're interested in joining us, please do. I'm giving you a little nudge, and $50 off. So the Black Friday bonus, you not only get my liver cleanse, but you're getting a little bit extra support. What's really cool about my liver cleanse is we're not only cleansing the liver, but we really help calm and really just calm the nervous system. So all my patients who have done it are like, oh my gosh, I feel so calm. This is so strange. It's really remarkable how quickly it kicks in and how even keeled you can feel. So it's awesome. So it's going to be it lasts 3 weeks. It really lasts 8 weeks when you buy it because it stretches out 2 months, but we work together for 3 weeks because that's the most intensive part. And so anyways, take advantage, guys. I never really run discounts. So, but I decided to this time. So see you later. Hope you enjoyed the live. Happy to answer any of your questions. Please like, share, comment, and see you next week.